So good morning, everyone. I think we can start if we want to stay in time. Thank you very much for being with us this morning. We are here in this roundtable on the socialprotection.org week of conferences with very interesting discussion. And for this roundtable for the next hour, we will be talking about the response to the COVID through unemployment protection and also its extension to workers in the informal economy. For the panel this morning or this afternoon, we have with us Mr. Kupan, Assistant Director of the Workforce Program Unit of the Ministry of Labor and HRD and Training of Mauritius. Very good morning, Mr. Kupan. And we also have with us Laura Alfers, from Director of the Social Protection Program from WEGO, and also Mrs. Renata Noah-Garmer from UNDP Africa. Very good morning to my two colleagues. So we're together for 1 hour, and one of my tasks will be also to help us to manage the time, because I know that some of us then we need to go to other panel, and we would not like also for you to miss other interesting discussion of this week. So when we're talking about unemployment protection, we can really say that the crisis has affected many workers, the COVID crisis, since its beginning, both in the formal and even in the informal economy. The ILO monitor on COVID published on 22 September's last estimate that globally the working time loss in the third quarter of the year, when we compare to last year 2019, might be equivalent to 345 million full-time equivalent jobs that have been lost since the beginning of the crisis. So it's one of the major employment job crises we had, for which responses will be needed to support the worker. And many of those who have lost their formal job find themselves in a very difficult situation. And if they cannot count with some kind of income security measure, unemployment benefits, it will be really difficult for them to cope with the minimum household expenses. And we already see, even in developed countries, poverty also raising among this group of workers who have lost their job. And in the developing countries, what we will also see is those from the formal economy will go growing the roles of the informal economy. In addition, this crisis has also exposed the wide gaps in income insecurity for workers in case of loss of job and livelihoods for those in the informal economy. So this job crisis really calls for governments together with social partners to find responses. And in fact, if we also look at the ILO Social Protection Monitor during the COVID-19 crisis, we see that 91 countries have announced a total of 152 measures only on unemployment protection. Among the many measures on social protection, 152 measures have been adopted to respond to this loss of income and job for many of those affected. So this measure aimed at providing income security for the workers who have lost their jobs affected by the crisis. Also some measure to intend to retain jobs in the formal economy. And also either by extending the already existing unemployment protection, and we will have here experiences probably from Mauritius, how the unemployment insurance scheme was able to respond to the crisis, as well as putting in place some emergency measure for those who were losing their job. Here we also have the example of Bangladesh that was starting some wage subsidy program for the garment workers, badly affected by the crisis. What we learned also from the last past months is this emergency response create opportunities to move and to transition towards more sustainable mechanism by establishing and strengthening right-based unemployment protection schemes, not only staying at the emergency situation, but learning also from this crisis to learn more robust system and prepare for the next crisis. And this will also require to improve coordination between social protection and employment policies. Nevertheless, this unemployment insurance scheme that were already in place and able to support some of the workers have also shown their limitation during the crisis. Their limitation in particular in reaching workers in the informal economy. And those were among those most affected by the crisis. And for those, solutions may still be explored to find proper protection in case of such a crisis and job loss. And this is what we will also learn from the two presenters, Laura and Renata, and what can be done for the informal economy in this case of job loss. And also the ILO, with funding from the ECDEFCO, is now implementing a global program aimed at improving synergies between social protection and public finance management, a global program for 23 million, a program that actually started before the COVID crisis, but has proven to be really effective to support the countries during the crisis. And currently this program, which is also co-implemented with UNICEF and the Global Coalition on Social Protection Floor, is now supporting 18 countries across the different regions in supporting governments of 18 countries to find effective solution, effective response to the COVID crisis, and in particular supporting countries to implement the unemployment protection that is needed now as an emergent response to this COVID crisis. In this program, also what is interesting, and this is what we will discuss during the panel this morning, is how can we really learn from all these experiences to build a better back and to build more sustainable social protection system that will be able to also respond to future shock that may probably continue to happen in the coming years with the threats of climate change and other risks that the global economy is also facing. And this is where, when we talk about preparing better the social protection system, the discussion around sustainable financing is very important, but also sustainable financing with solidarity. And all these questions will be discussed during the panel, and we will highlight country experiences. We'll try to bring on these examples that are being deployed at the country level. And we will also discuss in the conclusion how we can build a better back with more robust, sustainable social protection, but also with always the promotion and the realization of this human right to social protection. So without any further, I would like to introduce our first panelist, Mr. Vishwananda Kupan, Assistant Director of the Workforce Program Unit of the Ministry of Labor, HR, Human Resources Development and Training of Mauritius. Mr. Kupan, the floor is yours. Thank you very much. Mr. Kupan, if I may ask you to unmute your mic, please, so we can all hear you.
That's good.
Thank you.
Okay, thank you, Celine. Good morning, everybody. Myself, Vishwananda Kupan, Assistant Director of the Ministry of Labor, Human Resource Development and Training. I'm in charge of the Welfare Program Unit, the Special Migrant Workers Unit, and also the Conciliation and Mediation section. So 3 sections for me, okay? So first of all, let me clarify that we do not have an an employment insurance scheme or social assistance scheme as in the European countries. But in Mauritius, we have the unemployment individual have a paid transition unemployment benefit. It is called transition unemployment benefit, which we call TUB. Okay, so the what we see intervention directed at unemployment individual in Mauritius. It was formally established by the Employment Rights Act 2008 and came into being in February 2009. Introduced in the wake of the global financial crisis, which affected Mauritius through a decline in demand, particularly in tourism and textile export, the program had the objective of reinforcing income and employment support in respect to expected increase in the number of workers laid off by companies. The workfare program was open to employment workers who were previously employed full-time at least 180 days without interruption. As long as their previous job was of sufficient duration, it did not matter whether it is formal or informal. Unemployment workers were paid 90% of their basic salary or wages or salary for the first 3 months, 60% of their basic wages or salary from first month to end of 6 months, and 30% of their basic salary, basic wages or salary for the remaining 7 months to end of 12 months. That is, the transition and employment benefit is for 12 months. From first month to third month, it is 90%. It was 90%. From first month to 6 months, it was 60%, and from 7 months to end of the 12 months, it was 30%. The transition and employment benefit was paid for a period of not less than 12 months, okay, up to 12 months. Participation is open for individuals with either a written or oral contract. To determine eligibility to be admitted in the workshop program, all reasons for job loss are accepted except for voluntary resignation. The Employment Rights Act 2008 was repealed and replaced by the Worker Rights Act, which came into operation on 30th April 2019. A worker who is laid off has to register himself with the Ministry of Labour within 30 days of the date of termination of employment to be entitled to the transition and employment benefit, and is paid as from the beginning of the month in which his employment is terminated, or where he has been given a notice of termination on the expiry of the notice. Where a worker registers himself after 30 days of the date of termination of employment, he shall be entitled to a transition and employment benefit accruing as from the date of his registration unless good cause is shown. Good cause means illness or injury certified by a medical practitioner, or the failure of the worker to register his complaint was due to the fact that he was abroad. So we have two things to say concerning good cause. First, he should be either he was ill or injury certified by a medical practitioner, or he was abroad. That's why he came after 30 days. With the COVID-19 crisis, where many workers have lost their job, government decided to amend the Workers' Rights Act for a period starting from April 2020 to March 2021 to pay the transition and employment benefit at 90% of the basic wages or salary for 6 months, and at 60% of the basic wages or salary for the next 6 months. You remember previously I said that the transition and employment benefit was for 3 months, 90% for 3 months. Now it has come for 90% for 6 months and 60% for the next 6 months remaining. In total, it will be 12 months transition employment benefit. Formerly, workers who have worked for less than 180 days were not entitled to the transition and employment benefit. But from 1st June 2020, and with the COVID-19 crisis, workers who reckon at least 30 days and less than 180 days continuous employment with the same employer at the date of termination of his date of termination of his employment, whether on fixed term agreement or not, is entitled to payment of TEB of 5,100 rupees per month from the period of the 1st July 2020 to end on 31st December 2020. That is, all workers who have less than 180 days but have worked for at least 30 days will be entitled to 1,000 rupees. Okay. With the coming in operation of the Employment Rights Act 2019, part-time workers who perform more than 24 hours work in a week is entitled to the transition and employment benefit, as it was in the case when the Employment Rights Act was in operation. It was not in the case. In the Employment Rights Act, the part-time workers were not admitted in the program. But now, with the Employment Rights Act 2019, Worker Rights Act 2019, and a part-time worker who perform more than 24 hours is entitled for the term. That is transition and benefit. During period that when Mauritius was in lockdown, companies in all sectors have benefited from wages assistance scheme provided by the Ministry of Finance, thus allowing the employer to pay full wages to their employees when no work could be performed. A self-employed assistance scheme was also given to self-employed person, self-employed who did not contribute to the national pension scheme. After the lifting of the lockdown from 2nd June 2020, only sector like catering are benefiting from the wages assistance scheme, as for example, the hotel are not open due to close of the airports. So to add that workers who lose their job are referred to the employment information center across the island to benefit from the public employment service for rapid re-employment. Okay, anything, that's all? Anything that you want to do?
No, thank you very much, Mr. Kupan, for this very interesting experience. I'm also showing how Mauritius, because it had the system already in place, was able to adjust the parameters and also extend the coverage to more workers in quite a quick manner to really come and support the families. Thank you very much, Mr. Kupan.
Because you see, actually, many workers are losing their jobs. So with the COVID crisis, so the government had to help these people.
Exactly.
That's why we have changed from 90% for 3 months to come to 90% on 6 months and 60% on 6 months. And we have given those workers who were not entitled to transition and employment benefit before 180 days. So everyone is getting their term now.
Exactly. Everyone is getting some support.
And it's provided that she has worked for 30 days.
Exactly.
Until
and provided that it was registered in the system. And then I will move to the next question with Renata Nowagama from UNDP Africa. Good morning, Renata. We were talking about the example of Mauritius, which was through the unemployment insurance very quickly able to support workers who had even contributed only 30 days. But what can we learn from the COVID-19 responses with regard to the protection of workers, but this time in the informal economy, in the same situation of job loss? And how can we extend the social protection coverage among this group of the population. Could you please share with us your experience also from countries in Africa? Thank you, Renata.
Great, thanks. Thanks, Celine, and welcome everyone. Yes, as you mentioned, I'm based in UNDP Africa, and so the perspective I'd like to offer is based on the regional perspective from Africa. As we know, Africa is highly informal. Around 90% of all workforce works in the informal economy. But the informal economy is the backbone of the whole economy. It constitutes around 55% of GDP for sub-Saharan Africa. So the COVID crisis is an extremely, it affects not just the fact that people are losing jobs, but also the whole economies, and show how vulnerable the economies and populations, families, and so on are. So the huge sort of learning from the crisis is that there is a huge gap. There's a huge gap in coverage in social protection for the informal economy workers. And you have discussed already why that is the case with lockdowns, with public health measures, with disruption of value chains, both locally, internationally, and globally. For example, in Africa, the estimates are that the job losses will be around 20 million. If we think about, for example, the tourism sector, which employs a lot of people in the informal economy, that's around 2 million, and so on. So, and these workers, if we think about it, obviously not everyone is poor who works in the informal economy, but most of the people are highly vulnerable to poverty. And because they have no social protection, no access to the formal social insurance, any sort of crisis or any sort of shock really can push families and individuals back to poverty. So this is the scale of the problem at this point. And so we've been monitoring also ILO and the World Bank, UNDP, and ICPIG. Yesterday we had a panel looking at different measures that governments have been putting in place to address the adverse impacts of the crisis on the populations. But let me focus here on informal economy workers. So given the size of the informal economy, we can say that it's not a surprise that the governments in Africa and across the world had to really act fast to protect the populations from its impact with different social assistance measures. We've seen mostly cash transfers, utility bills coverage, ad hoc emergency food support, and so on. And they've been trying also to reach out specifically to informal economy workers, but the issue here is that they simply, as you have mentioned, Celine, are not part of any national registries, databases, or any sort of, many lack even identification in African context. And so it's really hard to implement programs fast, especially in the context of public containment measures. So that's the huge, I guess, one of the biggest challenges, and also the issue of mistrust often between the informal economy workers and informal economy organizations and the government. But in general, the government had to basically, there are three choices to expand the existing programs, which, as I said, might have been and is difficult because of the lack of registration and lack of registration, but also lack of existence of these records and IDs. Top up programs that already exist, so that informal economy workers also benefit from that, or initiating the new programs. So if you think about top-ups, in a way, because of the fact that informal economy workers are outside of those registries, the top-ups could be a good, the top-ups, for example, if you think about countries, and in Africa, many countries have child grants. If you think about the fact that households with children, that most households actually are households with children, if you top up then the child grants, which has been the case in South Africa and in other countries, then automatically you reach the informal economy workers, and this is sort of a shortcut, and it builds on the existing system, so it can be an easy way without targeting, without the need to target. But the top-ups could also be not just in terms of the cash transfers, in terms of food transfers and in-kind transfers. And I understand that in Mauritius, and perhaps the colleague from Mauritius can confirm that, has used the social registry of Mauritius to reach out to 35,000 households in response to COVID with food transfer, for example. So the existing registries can also be used for that if they're part of the registries. In terms of the new programs, there have been some interesting new programs that we have seen in South Africa. I think Laura will talk about that. In Togo, everyone talks about how fast Togo was able to respond to the crisis with implementing cash transfers for 12% of the population in a record time of 10 days or so. And in many other countries, in Burkina Faso, Sudan, and other countries, the governments are trying to introduce cash transfers as new programs to the informal economy workers, but they're all temporary programs, and I think that's the major issue that we have, that they're really a band-aid on a gap that is massive and that needs to be addressed in a systemic way. Interesting, perhaps one quite interesting learning and lessons from this that we can also take for the future, and this will be my last point, is that obviously in many cases self-targeting has been implemented as a way to reach to the informal economy workers, and then people who have sort of self-targeted themselves to programs through different digital solutions, which is a huge shortcut, and also another huge lesson that we have to look at in the future, is targeting out. And in a few countries, in Namibia and in Cabo Verde, the government decided to first sort out who already gets unemployment insurance because they're part of the formal economy, so they're part of the tax records. Then who gets social assistance because they're part of social assistance registries, and the rest of the people assumes to have no other forms of support. So this is the targeting out methodology, which I found quite innovative and interesting, and they've been getting transfers. But again, these are very short-term solutions that are being implemented for a few months, and what we really need is a sustainable change and shift in how we go about protecting those in the informal economy workers, because we can be sure that the next crisis will in fact happen in the future. So we need to raise resilience of people in the informal economy workers. And as UNDP, we've actually, before COVID hit, we started to look at this issue with studying some examples from African governments and how they've been trying to implement some models and innovations that can help covering those in the informal economy through different modalities. That is the cost sharing by the informal economy workers themselves and the government, with financing or co-financing by private sector and other actors. So these are very interesting developments that I think will be studied with renewed resolve now that we are still in the midst of the crisis. And actually, Laura will talk about those experiences because she's been part of this project with UNDP. So I will stop here and thank you very much.
Renata, thank you very much for all this very interesting information and also the concrete example that you shared with us coming from Africa. How country you were mentioning, Togo, in the matter of 10 days, they were able to deliver benefits to over 450,000 people. It's quite impressive. And it really shows that a solution can be found also to extend coverage to the informal economy. Before giving you the floor, Laura, I would just like to remember to all participants that you can leave questions in the Q&A box, and we will have enough time after Laura for an interactive session when we will be happy to respond to all your questions. So Laura, Renata started giving us a bit of information on this compilation of practices that you've been conducting together with UNDP. Would you like to share with us more of this information and countries examples? And we know also that you're based in South Africa. There's a lot of interesting experiences there, including for domestic workers. So Laura, the floor is yours. Thank you very much.
Thanks, Celine. Yes, I will be sharing some examples from some work with the UNDP that is not yet published, but just sharing some pre-insights which might be of interest to this panel. Perhaps I can start off by talking about the South African Unemployment Insurance Fund. So that in the early 2000s, that was opened up to certain groups of informal employees, I should say. It's still not open to the self-employed, but domestic workers may access the scheme as well as farm workers who are informally employed. And for domestic workers, this was enabled by allowing multiple employers to contribute for one domestic worker. So that was the big sort of legal reform that has enabled the inclusion of informal workers. And I would certainly say that the unemployment insurance scheme already having some of these workers on its databases, I mean, which surely enabled it to move faster in terms of getting at least initial grants out than, say, the special COVID relief grant, which came through the social assistance system, where informal workers were not registered, and they used the targeting out approach that Renata spoke about, but which took quite a while to implement. But I would say, I mean, and this is probably the case for social insurance systems around Africa, and I mean, there are some exceptions, Mauritius and some of the North African countries, I think, that there is still a struggle to gain real traction in the informal economy. And this is true with the unemployment insurance fund. And estimate about 20% of South Africa's 1 million domestic workers were registered with the UIF before COVID hit. And by May, only about 13,000 workers had received the temporary employer relief scheme fund, the TERS benefit that the government put in place. So I would say, I mean, that's an advance. That's 13,000 more domestic workers than would have had something previously. But, by July, the government was estimating that 35,000 domestic workers had received benefits under TERS, which is still only 3% of domestic workers. To the credit of the government, they have, so originally you could only apply for the TERS benefit, the unemployment insurance benefit, if you were registered. And under pressure from domestic worker organizations, farm worker organizations, and their allies, the government changed that regulation to allow domestic workers who were not previously registered with the unemployment insurance fund to register and receive benefits. And also they were able, so usually it's the employer who has to register the employee. They bypassed that and said that domestic workers could register themselves with the fund. But there were a lot of problems with this. Ultimately, it turned out to be very difficult for domestic workers to register themselves. There was a helpline set up. The helpline was non-functional. Even the Domestic Workers Union Sadsaru, who were trying to register their members, couldn't ever get through to the helpline. So although those provisions were put in place, they were not as functional as they could be. And then there were also massive holdups with the payment of the benefits, which has done little to help what Renata mentioned as the issue with lack of trust. If you're going to set up contributory schemes, it's definitely important to have trust, and I would say what's happened in South Africa under COVID with the delays in the UIF payments has not done much to enable that. But I would say, I mean, the big problem is, and this is all about the short-termism, the quarterly labour force survey data has just come out in South Africa showing that 311,000 workers in private households, and that's mainly domestic work, have lost their jobs. So if we put that against the number of domestic workers, that's a third of all domestic workers have lost their jobs in this country. And even if they are receiving the TERS benefits, what happens now is the question. So I think there's an important question about how these unemployment benefits are then linked to other labour market services. But I mean, I think that South Africa is a positive example. I mean, some of the other good examples of extending insurance and to informal workers and getting high coverage rates. I mean, we've heard about it. Rwanda's community-based health insurance scheme has a 94% coverage rate. So that's not unemployment, but it's, you know, it works along similar principles of contributory insurance. The difference between this and a lot of the other schemes that we see in Africa is that it's been going for a long time, you know, since the early 2000s, whereas a lot of the other schemes we've looked at in Africa under the UNDP project are really recent, really new schemes. And so it's hard to say that we're seeing great coverage rates there, but I think that there are some really, really interesting innovations in the way that the insurance schemes are being adapted to the realities of the informal workforce. A pretty exciting one is Rwanda's Izo-Heja long-term savings scheme, which has, you know, flexible contributions. Informal workers can contribute at any time and any amount. Once a certain savings level is attained, 40% of savings can be used to fund priorities, starting a business, building a house, paying for child's education. There are incentives towards contributing: free health coverage for 3 years, tax relief, life and funeral insurance, so putting in short-term benefits with long-term benefits, co-contributions from the government on a sliding scale according to income categories, the use of digital technology. And I'm going through these because I think that these are some of the important things that if we're talking about contributory social insurance schemes to reach informal workers, these are some of the innovations that are being put in place. And I think time will tell about how well they work, but certainly they are interesting. So I'll leave that there just as a quick overview.
Yeah, thanks a lot, Laura, for these additional examples. And we have actually a question from Richard, which I think maybe you can help us to answer in the Q&A. And if people haven't found it, I will read it. So with discussions for government that are not implementing unemployment benefits, what are the other alternatives to making sure that informal workers in the deprived area could also benefit from social protection? Would you like to share some example, Laura?
Sorry, Celine, I'm not looking at the same question as you. Could you just repeat the question?
Okay, sorry. So basically, our participant Richard is asking, in case there's no unemployment benefits already in place in the country, what can be done? What are the other alternatives to make sure that informal workers in the deprived area could also benefit from social protection?
Well, I mean, I think that this has been one of the big questions that Renata spoke about, is the attempts to rapidly expand social assistance and get cash grants out to informal workers has been one of the big sort of aspects of this crisis. And there've been several ways to do this. I mean, there's been the on-demand registration where, you know, just in order to find informal workers, you know, you've had to use your mobile phone and provide your ID number, and the government then checks you against whether you're on the unemployment insurance or whether you're receiving another benefit. And if you aren't, that was one way to find people. The other way, I mean, there were multiple ways to try and look for people. There was geographical targeting, sort of looking at informal workers in certain very concentrating on getting benefits out to them. There was movements through the unemployment, I think we saw in Jordan and Morocco, where social insurance schemes actually made it possible for informal workers to register with the insurance scheme and be paid a benefit even though they hadn't contributed to the scheme. So those are at least, I think, 3 ways that governments have tried to reach informal workers, and there are many more, but those are some examples. But also to say that a lot of informal workers haven't been reached by social protection in Africa during this crisis. The gap is very real. And so I think there's a lot of work to do to ensure that informal workers are incorporated into social protection systems on a much greater scale than they have been now.
Thank you, Laura. And maybe to share a concrete example that Renata started telling us earlier, the case of Togo. Togo, the government launched a Revenu Solidaire Universel, universal solidarity income, and very quickly they were able to reach a large number of beneficiaries. They have now over 500,000 beneficiaries, but in the matter of 10 days, they reached the number of 400,000 beneficiaries. The way it worked in Togo, and we have similar experience in Thailand, the government advertised the scheme. The scheme was targeting areas being epicenter for the COVID-19. So in the case of Togo, it was mainly in the suburb of Lomé, and through radio and other channels, the government advertised for the scheme, and the beneficiary went to register online, also including through mobile phone, to receive the cash transfer. What was also important in this case is to define very clear criteria, selection criteria, to make sure that those who were registering were indeed beneficiaries or were responded to met the criteria for receiving this cash transfer that the government was offering. And I think what is really interesting in the case of Togo, but I was also mentioning Thailand with similar experience on voluntary registration, Togo now has this database of 1.3 million people who have registered. Not all of them met the criteria for receiving the benefit, but this database, which is mainly a database of people working in the informal economy, it's a very great opportunity for Togo now to provide incentives and to continue advocating, raising awareness among this group of workers and population, to also encourage them to join the voluntary scheme for informal workers that exists already with a social insurance system in Togo. So this database that is now in place with 1.3 million is really an opportunity. It's the first time that Togo has such a registry of not being the poor people of the country, but workers in the informal economy that can also be captured to join the social insurance system. We had another question from Rabia Razaki that I will read because it seems that not all of us, we have the same question. Cash transfer generally have been seen not to have a conclusive exit strategy, or in other words, a strategy to graduate people out of their adversity in the aftermath of a pandemic or otherwise crisis. If the same investment is done in a long-term and sustainable unemployment guarantee scheme, it may be more effective. Is that because schemes don't often consider political economy, social and development indices, and what first step can be taken to bring reforms? I don't know if one of our panelists would like to answer this question. I'm opening the floor to our panelists.
Yeah, Celine,
Yes.
yeah, I can take this. Absolutely right. I think that all the measures that we have seen, a big sort of issue with this, that these are temporary measures, and after a few months, when the lockdowns finally, the restrictions are lifted and so on, these cash transfers and other schemes will probably disappear. And what is important here is not to have this experience going to waste. And as you mentioned, for example, in Togo, there is already infrastructure, so to speak, social protection infrastructure being built for the delivery of cash transfers. There are other experiences that we're learning from in terms of digitalization, in terms of how to actually reach those people who are not part of any registries. So these should really become part of the thinking of what kind of long-term solutions exist and could be strengthened going forward. So I think that these cash transfers should not really be seen just as one-off intervention, but really direct policymakers to the fact that a longer-term protection is very much needed. And it's very true also that these are very politicized tools, and of course one needs to be careful in how you exit. It's easy sort of to implement, to start cash transfers in a situation like that, but it's much more difficult now to sort of withdraw from the support. And the income or employment guarantee schemes, if I understood correctly, that you have mentioned, could be a good one of the tools that policymakers would have for those who need sort of special or certain days of guaranteed work, and for the most vulnerable, including the informal economy workers. So that that would be my take on that question.
Yeah, thank you very much, Renata. I see that Laura is not with us anymore. Laura, can you still hear us? Yeah. Okay, I see you're connecting. Yeah. No, thank you for this very complete answer, Renata. And I think it's important also when we design unemployment benefits that we make sure we also link with employment policy that will help people in the case of formal economy, either to retain them in the employment or to help them to return to employment under formal employment, not the informal economy. That's also a function that can play an employment insurance scheme. By providing this support, we keep people in the formal economy. But the same goes also for cash transfer in case of job loss for the informal workers. It needs to be supported by a package also of policy that will help these people to move on, and maybe some counseling for helping them to continue developing their business or orient them towards market. I see we have a lot of question and answer, which actually as a moderator is not easy to handle because questions are coming really fast. And I'm sorry if I'm not taking on the question. I have no one coming to my screen. Are there examples, you know, of social organization or cooperative being involved in providing access for informal workers to contributory and employment scheme as a kind of intermediary of formal employers? I don't know if Laura, Renata, Mr. Kupan, you would like to answer to this question? Yeah. Indeed, it's that's while our other speaker maybe can complement. We have an experience in again Africa, Ivory Coast, where through the COVID, or as a response to the COVID, the government decided to put in place also a fund to support the informal economy. It was mainly to support the business rather than the workers. And another fund on another side also to support cash transfer and extension of cash transfer. And the discussion was, how do we reconcile the two funds and to make sure that those who will also benefit from the cash transfer can also be part of the informal economy. And the discussion was how can we work with social organization or occupational organization that represent a certain sector of the informal economy, such as handicraft or cooperative or small shop owners, to be part, as you said, as intermediary to be in the discussion, represent the interest of the informal workers, and also defining their role then in the implementation of such schemes. We have examples of countries where such organization can play an interesting role in collecting the contribution to those contributory schemes on behalf of the informal workers, and then transferring this contribution to the social insurance institution when such a scheme exists for self-employed or informal workers. So it's actually a function that this organization can play. And we have seen in many countries, Mongolia is one of them, where the cooperative for herders play this role of intermediary to provide information, communicate, collect contribution to pay the social insurance system. We're receiving more questions. Yeah. I'm taking one, another one, I'm taking them a bit randomly. Is there any country example using a targeting out approach where people did not have the self-register and benefits were paid out automatically to those not receiving any other benefits from contributory or non-contributory schemes? Renata, you talked about the targeting out approach. Would you like to respond to this question?
Yes, sorry. Yes, so, and perhaps Laura can complement, because one of the countries that I believe have used this approach was South Africa, but also Namibia. So the idea is basically to exclude the people who are covered by the formal economy, by unemployment insurance, and also exclude the people who are covered by social assistance and have other benefits. And because of this approach makes sense because of the high informality of African, for example, in African countries. So for example, Namibia, I have this example here, has provided an emergency income grant using this methodology by using the tax records for the persons who are under the formal employment relationship, and looking at social assistance programs registry, and then delivering cash to those who are left out from this system. But perhaps, and I already mentioned that an interesting approach is also, which also many countries introduced, and including South Africa again, so maybe Laura can talk about it, is if we think about households that have already cash transfers because of their vulnerability criteria. As we know, in Africa, most cash transfers as part of social assistance are provided to households who, number one, are under the poverty threshold, number two, have usually other vulnerability or a person within the household, so for example, person with disability or households with children. So if you actually top up these benefits during the crisis, you make the system in a way shock responsive, and you can extend the payments to those households in a relatively simple manner, because you don't need the registration and so on. So this is another another example of how the policymakers were trying to address the issue of the lack of registration by the informal economy workers.
I can add to, sorry, Selena, is there time?
No, you have 30 seconds, Laura.
I have 30 seconds. Just to say that, I mean, the South African case was interesting, and although it seemed slow, I mean, they started talking about the special COVID grant in March, and I think the first grants were paid out at the end of May. So it felt slow, but actually compared to many other countries, that's relatively fast. I mean, we've heard of countries who've only actually implemented their grants in July. So that approach, it felt slow, but perhaps did actually work faster than other approaches. I should say, though, that the South African case was problematic in that it has had a bit of a gender bias built into it, in that there was a grant, a top-up grant added to the child support grant, which many women receive, but that was per household, not per caregiver. Not per child, sorry, it was per grant. Whereas the special COVID grant went to individuals, but those women who received the child support grant were excluded from receiving the special COVID grant because of the targeting out approach. So it meant that women were receiving a top-up per grant, whereas many men were receiving the per individual special COVID grant. And so that did introduce an element of gender bias, and I think that was also the issue in Namibia. So it's important to think about, you know, that this is a top-up that we need to still remember that existing vulnerabilities are existing vulnerabilities and need to be covered. And that on top of that, you do need the COVID grant. Thanks.
Thank you, Laura. I'm looking at the time and we're already 1 minute late. Before thanking our speaker, I would like just to quickly wrap up and giving 4 takeaway messages that I'm taking from this very, very rich discussion. The first one will be, it was shown through various experiences that it will be important to link this cash transfer with some policies to either to retain employment or to help people to return to employment or to help the informal economy to continue developing, strengthening their business as a first key message. The second one was through this very interesting question is it's important to also engage with representative of the workers, the employer, the private business, and also representative of the informal economy, cooperative, to make sure that those schemes are adapted to the needs of the population. Another important message we talked a lot during this discussion is this COVID really showed that we need a more robust, sustainable, and equitable financing for securing social protection system, building social protection system that will be able to continue answering the need of the people, but also prevent and respond to future crises. The third message, we see it very clearly through all this country example, there's still a lot of room for innovation, new ideas to reach out the informal economy. And the COVID was also the opportunity of an effervescence of new schemes, new cash transfer for the informal economy. We talked about Togo and other experiences. It will be interesting to see how so quickly, in the matter of 10 days, they were able to disburse the payment. And very importantly, my last message, we also talk a lot about this issue, is extension of social protection to informal economy workers will not be possible if there are not very clear and strong commitments toward the formalization of the economy. The formalization of the economy, extension of protection to informal economy workers really goes hand in hand, and without having the support through policy for facilitating the transition, it will be really hard to continue expanding in a sustainable and adequate manner the protection to informal economy workers. It's 10:04. I would like to stop here, but I would like my last word to really thank our speakers, Laura, Renata, my colleague, but also Mr. Kapun, who stayed with us for the 1 hour session, who shared this extremely interesting experience of Mauritius, showing us that even a country highly dependent on the global economy, tourism, was able through its institution to provide some support to the workers and the family. So thank you very much for everyone for attending this webinar, and I wish you a good continuation of the day. Thank you.